Really, Dr. Balam, you might get many more comments on cardiology than anything else. Dr. Ravindra Goswami is one of the youngest Dr. Shanti Swarup Bhatnagar awardees. He is a very quiet worker, he keeps working. Are you still thinking about some new projects? If you are still thinking, I'll ask Sandeep to give his opinion, otherwise you can just give a couple of observations.
I think the most fascinating aspect of the medical science, which I find, is the ability of the physicians to diagnose the illness of a patient just by seeing the patient. You probably may not be knowing that the moment patient enters the clinic of a doctor, half the diagnosis is made. And it's true for almost most of the medical problems. For example, be it neurological problem, by seeing the mild tremors of the patient, by the blank expression of the patient, be it tuberculosis patient, be it hormonal disorders. Most of the hormonal disorders we can diagnose at one look, and cardiology, nephrology disorders, jaundice. We need not even examine the patient, and and if you see it from a mechanical point of view, it's just like mechanic diagnosing the problem of a car by seeing the dent on the bonnet. But here there is not even dent, these are micro dent which we are able to experience, and with the training which we get from our predecessors, our senior teachers, and the way we imbibe, our human mind imbibe, that is the fascinating aspect, and you can say that with just the eye power we can diagnose the problem. Second interesting point is the simple tools. Once the patient enters and sits on the stool, with a simple tool like stethoscope, which can diagnose many of the cardiology problems, and we won't even go to the sophisticated test. The hammer, which you have seen, it is just probably 20-30 rupees cost in the market, and half of the neurological disorders can be diagnosed reliably with the 20 rupees instrument. So these are very fascinating aspects of the medicine, which I see that you can say that there is a magic wand or magic stick which can be used to diagnose the problem, and we have stethoscope by which we diagnose the neurological problem. So it's a truly amazing problem. And lastly, some of the aspects, the treatment which we give to the patient. Some of the treatment are so simple that you can say it's just like you must have heard about which comes free of cost by many yogis. So for example, if you take the cost of vitamin D or thyroid treatment, it is 5 to 10 paisa per day. Truly, if you calculate the cost of this medicine, and the wonder these drugs does to the patient in terms of cure, a fully bedridden patient, and with just 20 rupees, she will be able to get up. I am talking about rickets and osteomalacia, where there is patient is absolutely bedridden because of vitamin deficiency. There is a muscle myopathy, muscle weakness, bone pains, and the patient runs from period to post for diagnosis. And just by taking medicine worth ₹20, they are able to get up. So it's not possible usually to treat a human machinery with such simple drugs, and it's possible to do that. Lastly, the ability of the physicians to predict side effects after a certain drug is possible these days, because now the whole genome sequence is available on the net, and we know that this is the normal sequence of the DNA. This Dr. Naresh Gupta has told. We know this should be the normal DNA sequence. This person has this much abnormality in the genome, and is likely to experience this kind of side effects or this kind of response to drugs. This is called pharmacogenomics. Before giving drug, we will come to know that response of the patient, whether it will be there or not, what are type of side effects person is likely to get. So there are many fascinating aspects which are coming, and which will give us like prediction power, or we can tell the future that probably. And this I consider that it's as good as fiction, that we can predict. And so that's all I want to say.
Thank you. Very well said, Dr. Sherlock Holmes. You can diagnose when a patient moves in. You can. This is true, and you can do simple tests. But at the same time, we give very balanced view. We heard some of you might also have heard Dr. Atul Gawande was here last week in this center itself, and he said 3% of the doctors use those simple tools when patient comes to them. Very sad. The simple story is high blood pressure, which can be diagnosed only when you check the blood pressure, but only 3% of the doctors check it. They take it for granted unless the patient tells them. So there is a problem. But you have raised a very, very important issue in treatment of what you said, personalized medicine and care. Very nice. Sandeep?
Yes, sir. So first of all, I want to thank you for a very eye-opener lecture, and I think it has generated a lot of curiosity amongst all of us. But taking rounds daily, what I found was that medicine behaves really different as we see as a physicians. Sometimes you find that there are patients with large stroke, large bleed in their mind, and they survive, and we think that he will not survive. And sometimes we found a very young patient with a very small bleed. We think that he will go next day or 2 days after he will go home, and next day you come, he was found to be dead. So there are some things are present which we have not discovered yet. That's why they appear strange to us. Maybe in future we will discover them, we will predict the disease much more powerfully, and then we can say, yes, this is the thing. Similar is the case when we give medicines to different people. Same medicine is acting differently. As Dr. Goswami said, same medicine is acting differently in a different way and producing different effect. So there lies some faith also with the doctor, which is acting somewhere and producing the effect. And two things. One, I just want to narrate one thing. I have heard that there were doctors when they take rounds, they even just smell the patient, and by smelling the thing, they